In Good Shape, your health magazine on DW, featuring an interview with a different expert every week.
Dr. Weber, you are Chief Physician of the Department of Psychotherapy and Psychosomatic Medicine. Thanks for inviting me into your clinic. This is a clinic and you're treating patients with anorexia and eating disorders, and we are not in a normal hospital room here, we're in a kitchen. So why is that?
Yeah, we are in a kitchen, and in fact we try to bring our patients into normal areas of living right from the beginning of the therapy. Instead of only sitting with them in psychotherapy sessions or on the ward or in medical conditions, we try to share as much as we can normal life with them. And then that implies that we go to the kitchen, we bake together, we cook, and try to bring as much as we can normal eating habits back to the patients.
So if you would put me into a kitchen and do some cooking with me, I would be absolutely happy and satisfied. But with those patients who have eating disorders, it might be a totally different story.
Yes, it's more complicated. What we try is that we are very empathic with these patients. We try to select what can they eat at a special stage of the therapy. At the beginning it will be very restricted, and we try to enlarge and more the spectrum of things which we can eat and prepare together.
So how young are you, the patients which are suffering from eating disorders like anorexia?
Well, we know that due to an earlier onset of puberty, patients get younger and younger. We speak now of girls of about 10 years of age where eating disorders start. And that is because of the influence of social media, casting shows, for example, which convey an image of the perfect thin body. And at the same time, we have hormonal reasons, like the onset of puberty is earlier, and we know that an early onset of puberty in girls is a risk factor for developing eating disorders.
But anorexia is not only about getting very, very thin, it's really a disease and it affects the body.
Oh yes, we know that the whole organ system is affected by anorexia. We know that the heart can suffer. We know that electrolytes become disbalanced, and that is related to rhythm abnormalities. We know that the kidney function is affected. We know that osteoporosis affects most of the anorexia patients. And we even know from fMRI studies that the gray matter of the brain decreases.
So if the body gets sick, do the patients usually recognize that they are sick, that this is a disease, that they need to get treated, or do you need to persuade them?
We need to persuade them. That's the main issue of the first step of getting them into therapy. Most of the patients are brought by their parents. The insight into the disease is not there. It's a feature of the illness that the body image is distorted. They conceptualize themselves as being too thick even, or too fat. And we can see that in video studies that the silhouette of the body, for example, is conceptualized as being too large or extended.
Some experts say that orthorexia is not even a real disease. What's your opinion on that?
I agree. I think it's a lifestyle habit. It's being vegetarian or vegan is a very hip method of bringing out what you think about our civilization society in a way.
It's a cultural thing.
It's a cultural thing. We have it in big metropoles like Berlin or Tel Aviv or New York, and we want to avoid meat or egg products or milk or whatever, and we try to convey a certain attitude of our life.
But is it very difficult to say that some condition is a disease or not? Not just with orthorexia, but take anorexia or other eating disorders, for instance.
Well, it's a very clear-cut definition. We have the body mass index, which gives us an idea, and we have a clear-cut definition of the body mass index being below 17.5, being the criterion for underweight.
That said, if the body itself is healthy and that you don't have anything like a malnutrition or a bowel disease. So you need the psychological factor as well.
Oh yes, of course we need to have a very good medical investigation. We need to do a laboratory or maybe even a gastroscopy or coloscopy, and we need to see if there's any bowel disease or any other, for example, gluten sensitivity or other things.
But if some of our viewers say, for instance, I've got a daughter and the daughter's getting slimmer and slimmer and I'm very, very afraid that she suffers from anorexia, what should they do?
They should bring her to a general practitioner, and he should do a very thorough medical examination, including a blood draw and an ECG. And then, when the diagnosis of anorexia gets more and more sure, he should go bring her to a specialist, a psychotherapist or a doctor specialized in psychosomatic medicine.
So like in your clinic here?
Yes.
And if you treat patients with eating disorders, what do you do? I mean, we hear it in some kind of an art room, so it's for art therapy. You see there are a lot of colors here for paintings. So why does this help the patients?
Well, what we try is to bring the patient in our boat. We try to become a partner of the patient instead of a treating or doctor. We try to be on one level with the patient, because the patients themselves, they don't see themselves as being sick. It's often the doctor or the parents which say, oh, you are too thin. But the patients themselves, they have a distorted body image and they don't see what they do, what harm they do to their bodies. So what we try to do, like for example here, is paint with the patients, we cook with the patients, we make music with the patients, so to enlarge the therapeutic room and to have some fun together, and also get more and more psychotherapy focuses into the picture.
And if you try to treat the underlying psychological disorder, is the body itself getting better, say, for the organs? Do they recover?
Oh yes, we can see that, for example, with MRI studies. We see a thinning of the grey matter in anorexia, and what we also see, which is very nice to see, is that the grey matter comes back to its normal range. Within 3 months of therapy, for example, with weight restoration, the brain substance increases again.
Good to know. Thanks, Dr. Weber, for inviting us into your clinic. Thank you so much.